Hi, I'm Mahesh Menon.
And hi, I'm Smriti Khanna.
Welcome to another episode of our podcast.
Living well.
Yeah. So today we have an interesting conversation for the next how many minutes that we can stretch it out to. And we have with us a very special guest. Could you introduce yourself, please?
Hi, I'm Niti Vaidya. I'm a writer by profession and I have been a caregiver. I have been a caregiver with my family for my father. I cannot say I have been doing this alone or I have been a primary caregiver. It was a collective job. My mother, my sister, and I care for my father who had a rare neurodegenerative disease called progressive supranuclear palsy. And we had a long journey. We had a 14-year journey
Mm-hmm.
with about 9 years of misdiagnosis. So, yeah.
Okay.
And as a result of this long journey of caregiving, uh, the sequence of events somehow culminated to you being involved in the support group for what is called as Parkinson plus syndrome, which you said progressive supranuclear palsy. Can you tell us what is the support group?
The support group actually, I started volunteering for an American foundation after my father passed away. So I started this in 2018, volunteering. I registered as their peer support volunteer, and any inquiry for India that they would get for support was redirected to me. CurePSP started becoming that one place, and then eventually, I think during COVID in 2020, around June, I realized that I have met families from different sections of the country, and while I could help them with my experience, I started understanding that there's so much new happening, and medicine grows every time, right? So I started realizing that I probably don't have all the information. It would be nicer for them to come together. So I shot out text to each one of them, the families that I knew known by then, and asked them if they would like to be on a group like this. When they said yes, because privacy is important, right? So especially in groups like this. So I once I had people saying yes. It was just one WhatsApp support group that I made. For most part of it, it was that. Then we started doing Q&As, and the doctors I knew because of my father's care, and his teams. I started approaching his team of doctors and healthcare professionals, and I started doing sessions with them. I was doing at least once in 2 months, and those Q&As started picking up, and then CurePSP was also spreading word. They helped me a lot. They helped me with the flyers, they helped me with their Zoom for the meetings. So I always have their support, back-end support for whatever I do here. And we eventually, now we are a group of 180. We've supported maybe about 250 caregivers over this span of time, but people leave. And I have met about 125 PSP families in since 2018, and
Wow.
yeah.
So for some of us who will be listening to the podcast and they tune into this, there'll be a couple of questions. So what is PSP? Now, when you heard it for the first time, what was your perception of what PSP was, and what do you know of it today?
So the first time I heard, the only thing that came to my head was my father was dying. But for us, we got to know about PSP very late in our journey. My father was already immobile. He was probably in the last stage, or maybe a stage before, like the third stage.
Why I asked you that question is because when we asked you what was PSP
Hmm.
to you the first time and how you have evolved into the word tau protein, and I haven't heard too
Yeah.
many non-medical.
Yeah, so now I know this. I didn't know it
Exactly.
back then. So for me, PSP was the symptoms,
Yeah, yeah.
because
Which is
that's
what
what,
it's like for
which,
anybody
yeah,
taking care of
because
Absolutely.
for me that was
somebody
it.
with a chronic
It was
illness.
the symptoms. We never really had an MRI done for my father to have a conclusive diagnosis, because by the time he had a lot of dyskinesia, an MRI would mean sedation. And our question to our neurological physician was that does it change his line of treatment or change anything for him? And she said no. And we said, then we don't want an MRI. We are happy with a symptomatic diagnosis, and we don't want to put him through the whole sedation and all of those. And you hear, I mean, you know, most times when you are in the journey, you believe anything you hear.
Very true.
You do, right? So I had read somewhere, and there were a lot of Facebook support groups. And I was a part, I was a silent member there, but I was a part of it. And I had read that sedation is not good for neurological disorders and brain diseases. So I said, I don't want it for Papa. And because I was the one who was, I literally had no career. At that point of time, my sister was working. So I was obsessed on learning about the disease. So first Parkinson's, I read everything possible that I could on the internet. Which is why it's surprising that I didn't come across a foundation that has been doing so well for people. And then PSP. So the diagnosis went from Parkinson's to a very short span, like about 15 days MSA, and then finally PSP. So the MSc news was broken to us when my father was hospitalized for hallucination. Overdosage of medication, Parkinson's medication. Some medications don't suit, not all medications suit all patients.
Yes.
So one medication was not working for my father, and it started giving him hallucinations, and the physician wanted to figure out what was not working, what was working. So we had admitted him to our hospital. And that's when his neurologist brought in a movement disorder specialist, and together they gave us a diagnosis. At first they thought it probably was MSA, which I think I'm grateful wasn't, because that would mean we would have lost him sooner. Because the way I was explained what MSA was very, very scary. And
So I'll just interrupt you there, because in this brief discussion that you've had, you've already highlighted the journey of a caregiver who faces a critical neurological diagnosis. Why? I won't even use the word critical. I would use the word a neurodegenerative condition, which leaves them immobile and dependent and, multiple needs. So you mentioned so many terms here already, like an MSA,
That's a lot
like
of
basically
education or a lot of knowledge kind of, just compressed into a short period of time.
And did you meet? When did you meet?
We met years later, but that's what I wanted to get from the entire journey of misdiagnosis to correct diagnosis, and then just saying, okay, let's just now take care of him at home. Then came your came the PSP support group. So this is actually the India version of the CurePSP support group?
It is. So we don't really have a name, because we are not really bound by an organization or anything. I do this single-handedly. I have my family supporting me with what I do. So if we have an in-person meeting, my sister would be there, and
Yes.
I would have people who support this, but we are not really a foundation.
Okay.
CurePSP supports what I do, because I have been their volunteer. So we always call ourselves PSP India, supported by CurePSP.
Okay.
So, and someday, hopefully, CurePSP and I, we both hope that we can figure out the government dynamics of an non-profit, and maybe,
Wow.
Yeah, I'm sure.
do
And
this.
how did the group grow? Because you said you had initially just a select few families, and now you have 180 families on the.
I'll just add to this question about the growth. Even before that, the first question I had was, what is a support group? Like, when you are a caregiver and you're going through this. So when you say, you mentioned that you went on Facebook and there were support groups. So if there are, if we want to understand, what would you say is a support group, and how did you reach a support group, and then how did you grow from there?
I'll tell you what I mean. There obviously there are textbook definitions of support groups where you find support when you're going through something, and it doesn't have to be a neurological disorder or cancer or something. It can be for anything.
Anything.
But for me, a support group is that emotional dependence that you can have, because especially with people who understand your journey. because not everybody understands what PSP is. So for them, this does not, like, we've had times where my father couldn't walk, but we had people saying, why not? He's not trying enough.
Oh.
But he can't. And like I said, you believe things, you also, you're in your head all the time when you're doing this. And you would also then push him a little and do something. And I had my father's neurologist, because my sister used to go to work, so doctor's appointment was my share of responsibilities. Unless I couldn't do it alone, then my sister would also be there, so she was playing multiple roles, while I was just being that caregiver, that the face.
Not
Yeah,
just.
let's remove the word just. Yes.
So
Yeah, both of us. Not just. That's a huge.
but so I had his neurologist tell me, if he's not doing it, it's because he cannot, not because he doesn't want to. Nobody wants to be dependent.
Correct.
And you need to remind yourself this every time you want to push him harder.
That's right.
And it's stuck with me, and this is something that I have passed on. So this is the kind of knowledge. So for me, the support group was this knowledge. Also, all the mistakes that you make as a caregiver. So I didn't have somebody telling me the right thing or wrong thing. My
Right.
family didn't, because we didn't know anybody with
Yeah,
PSP.
yeah.
It was, I thought we were the only people.
Yeah.
Especially in India, because the American support group, the Facebook group, had only American or European people on it.
Yeah.
I had not met a single Indian family, or maybe because I was not very vocal. Possibly. And I think it's very Indian of you not going out there and talking about your medical history.
Illnesses.
We are not as
Yeah.
vocal as the East when it comes to all of this. I've
As the
realized,
West,
because
yeah.
they are very open about their journey, so open that they would actually, you could learn from their whole. There is a graph that you could make if you are following your patient on those support groups.
Yeah.
Which
yeah.
possibly,
That's true, actually. It takes a lot of courage, but it also takes, I think, a certain kind of like nature, nurture, all of that.
Yeah, we are taught not to
we
speak
are
about
taught
our
not to speak
problems.
about the bad things, while
Yeah.
maybe for them it just comes easier because that is something that they have been open about sharing right from the beginning.
I'll also point out this thing. It's an observation about how we don't have those boundaries. Like, in a group, you'll have people randomly discussing medical histories and their problems, and 10 people listening. So the concept of privacy, confidentiality, like, we're sitting and we're discussing gas troubles in public. But when it comes to like real hardcore that people
Yeah.
can
We
actually
don't have
benefit with,
people
yeah.
talking
I think the
about
real
it.
problems, or like the problems which really get you down, are not
No.
things that we end up talking about.
Because you're supposed to be strong for the world. That's how we are conditioned, probably that way. We are conditioned to have a strong face. We are conditioned to say that, okay, even if this is happening, we are fine.
Yeah.
So I think
Smile through it all.
we probably are not very open about our if I could use the word mental health, or what our feelings, our emotions, which is why probably we hold back such information,
it.
because you are going to end up talking about how you feel about it.
So this was Niti in that situation 7 years ago. What would Niti do and what is Niti doing when she meets someone who's in this situation today? What has changed? The people who are not opening up, or they're not able to seek help.
So I when I speak to a new family, what I do is I first start talking. Give a brief description and tell them who I am and what I do and why I do this. Because I have been a caregiver to my father, and my family has this set of experience of 14 years. And so once you tell them about, you open up to them, they are more welcoming towards talking about themselves. You start with smaller things, and if I realize that they are very early in the journey, I don't talk about the end of life journey.
Right.
I talk about what you could possibly do then. And I make sure that they know that I'm available. Talking to me doesn't mean they have to be on the support group. I support a lot of families outside the support group also, because it's very overwhelming. I cannot divide families into walking, not walking, end of life.
Yeah.
It's impossible, because
So it's overwhelming because lot of information, or lot of like
if you are in an early stage of the disease, and there are going to be families who are towards the end of the disease or have progressed fairly to a point where they are immobile, they are on PEG tubes. So that information, especially the PEG tube information, is very scary for somebody who is just getting to know the
Just
disease.
getting into it.
So I make sure that they know. Like, I recently had a patient get in touch with me, and to answer your question, how I get to know more about how more families can approach me, a lot of neurologists have been very supportive and receptive to our group. So
Wow.
they know about me, and they share my number with families who they think might benefit from the group.
And is it localized? Is it just a Mumbai phenomenon, or do you
I
get?
have been trying to get in touch with neurologists outside. I have managed to get in touch with a couple of palliates outside.
Yeah, neurologists who are listening to this podcast, which is like 3, but please spread word that there is someone like Niti here who's doing this. Yeah, please continue.
Yeah, so I have that happening, and so doctors usually send in like give my number to the patient's family or the patient, and they get in touch with me. Sometimes they WhatsApp, sometimes they would just pick up the phone and talk, and I make sure that I speak to them. And if it's a patient, like recently a patient had connected with me, I made sure that she would know that the group is primarily caregivers, because when it's caregivers, there is caregivers burnout, and there is frustration, and there is the conversation of that frustration happening on the group, which is very hard on the patient. They are already having a hard time.
That also can be overwhelming to listen to.
So then you're
Yeah.
going to have that conversation with your kid or your
loved
spouse,
one, huh?
and I don't think my father would want to know how I am dealing with. I don't
Yeah.
want him to know, rather than him
Correct,
wanting to
correct.
know or not. So
It's a difficult dynamic, no?
so I just told her that there are people with different phases into the disease, and since you've just gotten your diagnosis, I would suggest you would have your loved one be on the group, and then let him figure out what the group is like, and then if you want to be on the group, you're most welcome. So she then added her son on the group. I make sure that I put that information out there, because I know it is overwhelming.
Yeah.
It would have been overwhelming for me. I have had people who have been on the group, who've exited the group and then been back when they thought that they were ready for it, because there are all kind of information. You have information which is like about who could I go to if I need a certain diagnostic
Like doctor,
recommendations,
lab, nurse, physiotherapist, any of this.
We have that kind of information. We are even trying to build a database pan India. We have a Google form on the group, so I every few months we keep nudging the families to do. Not everybody adds those information, but as much. I mean, it's not a compulsion.
Correct.
It's voluntary. So we are trying to build that for our families, so that you can always go back to that group, and if somebody is from Pune, and if somebody has filled in information for Pune, then they could have
And they have
references.
something.
I have a lot of references for Mumbai, because I am from Mumbai,
Yeah.
and there are a lot of the physicians that have been recommending are from Mumbai. So a lot of Mumbai families are on the group. But I'm trying to make sure that we can reach out to other cities, because I think it's important.
Wow. Do you have a question?
No, I just wanted to understand that if you look at the distribution of the PSP group members, so you said that most of them are from Mumbai, and
Not most of them, but yeah, I would say like about from 100%, I think about 30 to 40% are in Mumbai, and then you have small sections, some from Kolkata, some from Delhi.
So what I was trying to say is that this 30 to 40% is largely driven by references,
Yeah.
and the rest are coming by word of mouth and by
CurePSP. Then so on Facebook also. So now so if a PSP family meets a PSP family, they would say that we have the support group. It is helpful.
So so this brings us back to that point where people don't like to talk about it, but people still are looking for help.
Yes.
So, and in India, that they're trying to find out. So that is it's very heartening in a way that there are people looking for it. So again, neurologists who are listening to this, please.
Or families with PSP.
Or families with
a loved
PSP,
one
there
who
is someone
has
to help.
PSP.
Yeah.
What I wanted to ask you is that how are the participants or the people on the group, how are they actually kind of helping each other? Like, do they have daily conversations?
I wouldn't say daily,
Huh.
but the group is active fairly most part of the week, and it's not always a sob story. We have somebody, if they have had a good time with their loved one, they would share pictures. If somebody is dressed their mom up for Diwali, they would share pictures. We share the good and the bad.
Is there anything recent that comes to your mind?
Yeah, so Diwali, there is a patient who really likes to dress up, and she can't. So her daughter has turned her saris into those ready-made 1 minute fixie saris, and she made sure she dressed her up, dolled her up like she would have liked, and she shared pictures with us, which was very, very overwhelming. If some patient has had their birthday celebrated, we would have pictures of those. So it's nice. We've actually turned into a family, and you know. It was not the intention. The intention was to help and make sure that the people knew that there was resource. If they had any questions, they could answer. Because I don't know everything, and I don't want to be pompous enough to say, "अरे मुझे तो सब पता है." नहीं पता मुझे. And this is where the group comes in, because I have no experience with PEG. So if somebody wants information on PEG, I can tell what I have read about, but it's not enough. I don't think the nitty-gritties come into it. So families with patients with PEG can tell you better.
Yeah.
We've had the same caregiver that I was talking about. She has actually had an informal Zoom session where she's explained how to use, clean
Wow.
a PEG tube. She's taken the time out. She's used like you doctors would do. She had some spare PEG, whatever.
That's a feeding tube. There's a feeding
the feeding,
tube.
yeah. The gastro.
The
Yes,
feed tube
yes.
is the feeding tube.
So she had how to clean it, how to maintain the hygiene around it. We've had an informal session there. We've had informal sessions where we've shared each other's speech therapy exercises, because not everybody can afford a speech therapist. So whatever I had learned, I had shared. Whatever somebody else had learned, they had shared. We shared all our exercises early. This was very early on in the after the group was made. We shared our exercises, so it's there. We have a Google Drive which is there on the group description, and all these videos I make sure that I've added within the first week, and it's accessible to everybody on the group.
From this comes the notion that actually the caregiver, the primary or the secondary caregiver who's taking care of that patient is by themselves a specialist. Like, when we think about specialists, we think about doctors, we think about people sitting in the consulting rooms in the big hospitals. But the person who has been day in and day out, 24 hours, taking care of that individual, knows day in and day out, knows moods, knows when he's awake, when he's not awake, when is the best time to feed him, when is the best time to move him, what makes him happy, even though it doesn't really show on the face. But and we don't think about caregivers as specialists, whereas they are. A doctor sees a patient once in 3 months, maybe for 10-15 years, but the caregiver sees the patient day in and day out for that entire 10-15 years.
So usually that's one of the main reasons why we listen to what the family has to say, because we get so many cues and so many points on how to take care of that person better.
Yeah.
Because we can give the medical part, but the caregiving part comes in from that experience of that specialty. And nowadays, with so much information available, it's tau protein, you said. I've still not overcome the tau protein that you mentioned. So yeah.
Yeah. No, I agree, because I learned so much about medicine just because, and I was a person, I had passed out, and my father's so my father had his knee replacement, his Parkinson's diagnosis, and his prostate surgery at around the same time in 2014. And we'd gone to see his doctor for his urologist for his prostate, and I had passed out, because it's the job of the doctor to tell you that हम biopsy करेंगे, cancer हो सकता है, We'll see if it's benign or not. All that information, and I possibly, I mean, I didn't understand what a panic attack looked like then, but I had a panic attack. The doctor had to leave my father aside.
And here to see you.
And he had to attend me. I was given some sweet to eat, and I was asked to calm down. This was me. And so when my father had his knee replacement, which was about 6 months after, I was not allowed to be
Yeah.
the caregiver in the hospital by my mom. And they said, "Tu ghar pe dekh. You do everything at home. Come in the visiting hours. We are going to take care of you." I was not allowed, and so I have had this. So PSP taught me to deal with crisis better, to a point where I started becoming the receiving end to information that hard information that I had to pass
Pass
on to
on.
my family. And I'm not saying I did it very nicely. I did it in tears.
I'm sure it's
I probably have a very high EQ, but I have dealt with the disease with a lot of tears, and but yeah, I grew from that person who passed out at the doctor's clinic to being able to talk
Wow.
about it. Uh, not saying that I've not had my journey where I have had a very hard time dealing with the diagnosis and dealing with my father's death even. And I think partly his death and how he died drove me to volunteer also. Because I had nothing to look forward to. I had literally, so it's not like I gave up everything to do this, but I was 17 when we had the Parkinson's diagnosis, the 2014. I was still studying. My father was the bread earner. We were two daughters. My sister is older to me, and she had just graduated. She was figuring her life out, and unfortunately, she had to stop figuring and do what was needed. But because I think that's the benefit of being the younger sibling, I got the chance to figure my life out, and. While I was figuring things out after my graduation, I tried chartered accountancy because Papa was chartered accountant, and I was good at it. But because I'm a hard worker, so obviously I was getting my scores, but I was not liking it. And then I tried a couple of other things, but eventually, because I was not doing anything, I ended up starting to help my mom at home, who was the primary. The spouse always
Almost
ends up
always
being,
is.
irrespective of the sex of the spouse, they are the primary caregiver.
So, what is your observation regarding a caregiver in the Indian context who takes care of people with conditions like PSP, in your experience?
They would, I would say, in Indian context, they literally, most caregivers are the spouses. They are the primary caregivers. The children support. I would say the same for my family too. And there are families where and it's usually if the patient is a woman, and if the family is not very is a little conservative, they would end up making the daughter-in-law, the daughter do most of the job. But I have had equal amount of men and women doing this. More women, you meet more women or more children because the PSP is diagnosed more in men than women. The statistics is that.
Okay.
So you would see more wives doing it than more husbands because statistics. But ladke bhi karte hain. And I have seen sons actually doing this from across the globe. Because somebody is moved away for work and the father or the mother is diagnosed and they have to do this. So I'm not sure if I get the term right, but there is something called distant caregiving also, right?
Yeah.
So they are doing this, they are doing it from another country, and they are in touch with us, they are on the group, because if you are from a small town, the parent might not even speak English, and because WhatsApp, so while we answer questions in all languages,
You need someone to.
you need somebody
Bridge
to
that
route
gap,
it.
yeah.
So
What's the percentage of people who have these empty nests and who have distant caregivers?
about 30 to 40% of
That's-
in the
yeah,
group.
that's a large number.
But there are families, and I would say that it's really nice, because there are families where the parent is diagnosed, the daughter is married, the daughter and the son-in-law also go back to wherever they are and take care of
Take
the
care of
patient.
them.
They do what needs to be done. There are people who have dropped everything and done this. There are people who just transitioned into it like me, and there are children who have actually had their own medical conditions
Issues.
and are still doing this. There are people who don't care at all, and they say we'll take one day at a time. There are people who actually have done so much research that, like you said, they probably know more than a physician. Maybe not a neurologist, but another healthcare professional. They have information to an extent that I don't even understand with research papers. So if I want some information, I go back to them and I ask them for help. Because, like I said, I don't know anything and I don't have the science background, or I don't have I'm not even very techy. So I can't really search the right things, and while Google tells you everything, but Google can be wrong too. So, if I have to
Yeah.
answer someone, I have to make sure. So that we have a whole set of
But
things.
you're giving us heartwarming news, huh, Niti? Like this is really wonderful to hear. I mean, it's heartwarming for a disease that is difficult to deal with. It's really nice to know that there is so much that you can access, so much that you can ask for help and support. Um, what do your support group what does your support group family say? Like, how has it helped them?
It has helped them. I always get very overwhelming messages. And it is overwhelming because I didn't intend it to grow so much. I wanted to help, and if I can be candid enough, I would say I was trying to deal with my grief when I was doing this. It's not really selfless. Like Joey Tribbiani says, there's no selfless deeds in the world. Okay,
of all people, you quote Joey Tribbiani.
yeah. But it's true.
It's true. It's
there
true.
is, even in that satisfaction that you get when somebody has dealt with a diagnosis like this better. I think I sleep well that night, thinking that I've helped someone better. You know, who doesn't like to be liked? Yeah.
Correct.
So 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 that's I always get overwhelming messages. What really amazes me is that they help each other too. The disease, as horrendous as it is, and I'm not saying that this is the only disease that's horrendous, but we've dealt with it. So for us, it's probably worse than the other diseases.
Correct.
Just perspective, right? And it brings out the best in you, because you want to help. They help each other. There are times like this 1 hour that if there is a crisis on the group, if I'm not answering, it's not like I have to answer every question. People are there for each other. You just, it's a family that's formed, and I think they connect better sometimes than their relatives also, because
Shared experiences.
shared experiences. Because in diseases like this, where the patient stops talking, it's very hard for the siblings or the extended family to see the patient. So the frequent visits also start dipping, and all of this takes a toll on the patient. So while you start thinking about all of that, and like I said, when you're dealing with something like this, you're more into your head than have a practical approach or have a perspective towards what is the other person is dealing with. So it helps. I get very overwhelming messages and a lot of grateful messages. And what I always try to say is that I do this and I'm more grateful because I have been able to help people not make the same mistakes that I've made.
Yeah, which is very important.
And I have made life-threatening mistakes when I was caring for my father. Just to quote an example, my father was aspirating. And I had read about aspiration, but I had not seen what an aspiration looks like. He looked restless to me. I gave him soda, I gave him Eno, I gave him Sprite, I gave him Nimbu Pani. I gave him all the wrong things. I should have just, tried to figure out how to get him to breathe better, or probably call a healthcare professional. But I did all the wrong things because I thought his sugar was dipping. And he was not a diabetic, so we were not in the habit of checking his sugar. And I did all the wrong things. And after he passed, so you start taking account of what you had been doing through these years, and I had a lot of time on me. So I took very, very, and I had been an accountant for a part of it. So I was just doing this was right, this was wrong, this was right, and then I realized that possibly this could help others. I spoke with my mom and my sister, and so my motive was to help people not make the same mistakes. But it turned out to be very overwhelming for me also, because I didn't expect the group to turn into this family where people help each other. If somebody is in the hospital, they make sure they check on each other. If somebody is having a problem with the physician or the doctor in charge, and needs to know how to do it, because there are sometimes there are caregivers who are kids who have lost one parent, and the other parent is the patient. Then the others in the group would come together. They personally also talk to each other if they are from the if they are speaking the same language,
Right.
Okay.
Yeah.
then
Yeah.
it helps you connect better.
Yeah.
So that also would take into account. And I sometimes if I view, just sit back and see, it is very, very overwhelming, because I didn't expect this. And I am glad that I did it. I don't know what got into me, and what possibly COVID. Again, too much time on me. So I decided to make the group. But I'm glad that I did.
So the structure of the group, is it like an IRL kind of a group where you like meet and have these meetings of caregivers, or is it like an online platform uh, on a WhatsApp group or?
Mostly online.
Okay.
We communicate on WhatsApp. We have a Zoom sessions.
That's what I wanted to know. Yeah.
We do Zoom meetings. We
It's an
plan those
email-based
meetings.
kind of a thing.
Not email, just Zoom and WhatsApp. And in person, Smriti has also been a
Yeah.
part of it.
Yeah.
That's when I
That's
got to
when we
know her.
met.
Huh?
Okay, so tell me more about this, because I'm.
So we met because she is in touch with the physician, the neurophysician who took care of her dad, and he and I work in the same hospital. And she wanted, like, the in-person sessions that PSP India
PSP.
has, sometimes have specialists come.
Okay.
So we have had gastroenterologists, we have had neurologists.
This is for patient caregiver education.
For caregiver education.
Okay.
But and that's when we met, because she wanted to have a palliative care physician come on board and talk about home care and palliative care
Okay.
for PSP. But what I find interesting is that they have different kinds of in real life sessions. So their last one, tell us about the last one.
The last one was where we do our in-person session. That hall was not available, and it just got me thinking if we could do this in a cafe, and not call any specialist. Because I asked if they needed any specialist,
Yeah.
or they just wanted to bond, because our sessions usually we've just had 2 of those. Unfortunately, because I couldn't do much this year. But so the format was the specialist, we would have an hour of specialist talk, and then for an hour, which would extend to an hour and a half or 2 until we were thrown out, the caregivers would talk amongst themselves and just share experiences.
Correct.
And ask questions. It would also turn into a medical conversation, because ye dawai, wo dawai, and all of that. But the caregivers were talking amongst themselves. So I just asked on the group, what do you want to do? We could find another place, which she was very well, she had suggested that I could help somewhere around here. And or we could just meet in a cafe, just minus
Yeah.
the doctors. So everybody really wanted to do that. So I just connected with a Starbucks in Bandra. And
This is a product placement section. This we come in with that, and
Where's the coffee?
Where's the coffee?
Where's the
Where's
coffee?
Go ahead.
and we just met. It
Lovely.
was it didn't even take a lot of time to. I mean, I wish I had taken the time to plan, because then possibly I could have had the patients also come in.
Correct.
But all those logistical details, I didn't have the time for it. But at least we families met. We were about 10 or 12 of us, and we just had coffee, we bonded, we had a good chat, and we dispersed.
Nice.
I have one question. How are your mom and sister dealing with you being on the group, talking about the same thing that they have also gone through so many times? Because what I've noticed in this last hour is that the number of times she has said, "This is overwhelming," much more than that, I've seen that she has a grin on her face all the time when she's talking.
Yeah, she's been smiling through.
She's been smiling throughout it and
That's
saying,
my
"This
defense
is
mechanism, just to let you know.
It's overwhelming, but this is what I want to do. This is what I love to do."
She's going to smile or she's going to faint.
Uh-huh.
So
It's better than not
Better,
crying.
yeah, better.
Yeah, you'd rather have me smile, right?
So what do they think about you going through the same thing in and out, which you were going through anyway
I
personally?
had a phase in my life very early on. I can say now I'm better, but I've had a phase. I've not been very candid. Indian family, we don't talk, but as in we talk amongst ourselves because we are a very close knit family, and PSP has only brought us closer. But I had a phase where I was having a very hard time, and there was a point where they checked in with me and they said, if this is getting overwhelming, you need to stop, because you cannot suffer because of it. But this is the only place where I am a confident individual, where I'm unlike myself. I'm a shy person. You might not have been able to tell, but I am very shy.
I can see a skeptical expression.
Skeptical, yeah.
Yeah, but so I'm not very. I mean, I would rather be alone in my room doing my own thing, maybe just watch Netflix. But I'm not very people. I don't like people too much. But this is one place where I bond with people. I was at peace. And because I do this, I have found that peace in my life, which I didn't after my father passed. And I have had a rough time dealing with his death. It's not like the first death in the family. I have seen a lot of closed ones die, but I think losing a parent is different.
Yeah.
And it was, from the anticipatory grief, which I had a lot. And I always at that point thought that, because I'm so, I know everything, I could even tell when it was ending, I would be fine. But I think the joke was on me, because I wasn't. And I had that hard time, and this group gave me that respite. So like I said, I am more grateful to the group than the group can be to me.
That's very sweet. That's very sweet of you to say that, yeah.
And so they know now that this is my happy place. I want to do this, and they're very, very supportive. Like I had my sister being supportive about this also. She was telling me what to wear, what to not do, and so they were more excited about this, and also worried. My sister was asking me if you want me to go with you, because they were afraid I would cry. So
Yeah.
It's a conversation which could go anyway.
So one question, the first question I'm going to ask you is, what can people who are listening to this podcast, or people who listen or pass it on, do when they hear about a group called PSP India? How can they contribute, or what can they do to take this forward, or make an impact, or make a difference?
So while the group is closed and only for PSP families,
Correct.
I would appreciate if people just went and read about PSP. Like CurePSP has humongous data.
Okay.
And if you search progressive supranuclear palsy is, it's their data that you actually see.
Okay.
They have so much data. I would just want people to educate themselves about PSP, because I have had experience where medical professionals didn't know about the disease, and my father had a crazy time in the hospital. To an extent that he came back an anxious person, and we had a long time to get him back to who he was. And
Okay.
he was a very happy person. He would, even when he couldn't talk clearly, my sister and he had this 1 hour in the night where they would listen to old musics, and she would quiz him about who's this actor, who's the singer, who's this, and he would even hum the song sometimes if he loved it. He was a happy person despite the disease, and he stopped being that person for a large part of it because he was put through a hard time. And he was put to a hard time because those healthcare professionals did not understand the disease. So I would just want people to educate themselves about the disease.
So this is a good point. But what I mean is when you said that, you're looking in terms of developing the organization, whatever comes to your mind, whenever it does, just put it out there. Because a lot of people who want to help, and it's not specifically for PSP, they want to help for different causes, but some of them might even listen to this term for the first time. So there's something called PSP, that a difference can be made. So
Yeah. But also, if someone out there listening wants to start a support group, what would your advice be?
Just meet like-minded people, and so if it's a PSP support group, find a way to connect with PSP families, and then too it's easy, just make a group on WhatsApp. But it's you just need to have that, the first time you do it, you need a lot of courage, because you have to be ready to speak about your story. And you have to be ready to give your time, because it takes a lot of time. And this is something that I feel guilty about, because other responsibilities sometimes get in the way of it. I'm fortunate that I have a group of people who understand that I have a life of my own and I have my responsibilities. But sometimes the expectations can be too overwhelming. Like it's a funny incident, but I have had somebody get in touch with me expecting me to take care of their loved one because they didn't want to.
Oh my God.
Saying that we could be in that same city. So and that's not what the support group is. So you have to be willing
hi,
to give your
when
time.
are you coming? What time can I expect you?
It's the time you have to give. And you need to be emotionally available, because you don't know when somebody else is going to have a breakdown. And actually I trained myself in psychology also because I had interest, but I registered in an open university and got my master's in psychology because I knew what the disease could do to your mental health. Also, when people spoke with me, they thought I had people telling me that it was very therapeutic, and I wanted to make sure that I was doing it right. So I had a lot of time on me, so I registered with an open university and got my degree through COVID. And so while I don't practice, and I don't think an open university psychologist can practice, but I use that knowledge for the group.
It's better than a WhatsApp university psychologist. No comparison. I mean, that's dedication, because you went out of your way. So the second part of the question, you answered part of it, but again I'm going to put you on the spot and ask you, what can doctors do if they are listening to this? Because we have some of our friends will be listening to this.
I hope they could come forward and volunteer their time for the group, because this is something that I genuinely want to do. And even if I'm not a foundation, and I'm doing this the way I am doing it informally right now, I would want healthcare professionals to come and give their time to us, because a lot of people cannot afford regular healthcare. I would want especially speech therapists, physiotherapists, which is very expensive, at the same time very, very important for
Yeah,
these
yeah.
patients. Because while you can't cure them, and medication helps only to an extent, and most time
Yeah.
for most people it doesn't even help at all. uh, you need to maintain their quality of life, and for that we need these doctors, palliates like you, physicians, neurologists. These are the team that I would want to make, and would want to make it in each city, so that I know that this doctor understands PSP. If I have to give reference to some, then I can say that please go to them,
Go to
because
them.
because not every physician understands, and it's fair. There's so many diseases out there. I don't think everybody can know everything, but if I am dealing with a PSP patient, and I mean my father, I would want my father's every healthcare professional, including nurses, to understand the disease, because your attitude towards the patient needs to be different with different diseases, right?
Yeah.
So that is one thing I expect. I mean, if I can get anything out of this session, I want healthcare professionals to connect with me कि हम help करेंगे.
Of course.
Lovely.
Yeah.
We're going to now ask you the question that we ask everybody who comes on. What does living well mean to you?
Good health.
Hmm.
And I think when I say good health, I mean physical and mental. Because if you are in the prime of your health, and if you're still in your head, which, like I said, I was for a small part of my life, you're no good.
Yeah.
You're the worst person people want to be with. So living well means good health, because growing up, like I said, I was 17 and I lost my father when I was 31. Your prime years, the 20s that you say, I have only seen my father's health deteriorate. While it's funny. It's a joke between my sister and I back then. My WhatsApp would have only doctor, 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 doctor. The first 5, 7 chats that you see, nobody. I didn't meet for 10 years. I didn't meet new people, because I wound it up at home. Um, so for me, living well means, obviously it's wishful thinking. No diseases. If there are diseases, no suffering.
Yeah.
This is all I pray for my loved ones. I don't want them to suffer. I've
Yeah.
seen my father suffer, and it's not something. And a good person, bad person, doesn't matter. Nobody deserves to suffer.
That's true.
Yeah.
Thank you, Niti. This
Thank you
was
so
a
much for
wonderful
having me.
chat. Thank you
Yeah.
so much for coming on to us,
I'm glad
coming
I
on
was
to
here.
our podcast.